Good evening. My name's Kenzie. Imagine waking up to find a preventable disease is rapidly spreading in your community, and the only thing standing between it and your loved ones is a simple shot. Now imagine if you could have prevented it altogether, but choose not to. The choice is yours. Vaccination isn't just a personal decision, it's a shared responsibility which can save millions of lives. So why are some still hesitant? I was born premature and in the pediatrics ICU for months. I eventually was diagnosed with cerebral palsy, which means I was born with underlying health conditions. As such, the possibility of catching just a simple cold could lead to bronchitis or pneumonia very easily. Vaccinations are not only essential for protecting individual health, but are crucial for safeguarding public health. Let's dive into understanding the issues of not vaccinating children, then look at solutions to educate parents about vaccinations. Lastly, I will share some steps parents can take to protect their children from illness. To fully grasp the importance of vaccinations, it's essential to consider the consequences of inaction. The first major problem with not vaccinating children is increased risk of disease outbreaks. Not vaccinating children increases the risk of disease outbreaks, endangering the unvaccinated and vulnerable. Vaccines have nearly eradicated diseases like polio and smallpox, but without continued immunization, these threats can return, especially with global travel spreading germs easily. Vaccination is a proven tool against infectious diseases. Without it, preventable illnesses resurface, disrupting communities and healthcare systems, as seen with COVID 19. The second major problem is vulnerability of high risk populations. Unvaccinated children risk their health and endanger high risk groups relying on herd immunity. The CDC states immunocompromised individuals face severe complications from preventable diseases. Vaccines protect individuals and communities, ensuring vulnerable groups stay safe. The third major problem is severe health complications. Not vaccinating children exposes them to severe preventable diseases with lifelong risks. Leading health organizations like the CDC and AAP endorse vaccines based on extensive research, confirming their safety and effectiveness. Vaccines prevent deadly diseases. Ignoring science endangers children and the public, making vaccination a moral and public health necessity. The fourth and final problem is increased healthcare costs. Not vaccinating children increases healthcare costs for families and society, while vaccines prevent costly illnesses. Unvaccinated children face higher risks of severe complications, leading to expensive treatments and hospitalizations, straining family finances and healthcare systems. Vaccination is a cost-effective, ethical choice that prevents financial and medical burdens, much like health insurance protects against emergencies. As I've discussed, the decision not to vaccinate children significantly increases the risk of disease outbreaks, putting entire communities, especially the most vulnerable, at serious risk. Another critical issue is the severe health complications that unvaccinated children may suffer, which can lead to lifelong disabilities or even death. Beyond the personal toll, the financial burden of preventable diseases places an enormous strain on families, communities, and the healthcare system. Americans can combat vaccine hesitancy by promoting accurate education, supporting pro vaccine policies, and ensuring access to immunizations. Misinformation fuels vaccine refusal. Educating families through schools, healthcare providers, and public campaigns helps counter false narratives. Society has a moral duty to prevent suffering through proven solutions. Widespread vaccination protects communities, lowers healthcare costs, and prevents disease resurgence. Vaccinating a child ensures they grow up healthy, free from preventable diseases. High vaccination rates reduce outbreaks, hospitalizations, and child mortality, letting kids thrive without fear or severe illness. Vaccination is a simple, powerful step to protect children and create a safer world for families and communities. One action you can take is to ensure your child receives all recommended vaccinations on schedule and encourage others to do the same. Vaccinating children protects their health and strengthens community immunity, preventing outbreaks and safeguarding the vulnerable. Vaccines prevent deadly diseases, inducing illness and death while keeping public spaces safer. High vaccination rates protect those who can't be immunized. With a safe and effective way to prevent disease, it is our responsibility to use it. Vaccination prevents suffering, saves lives, and ensures a healthier future for all. Another action that can be taken is to ensure your child is fully vaccinated to help protect high risk individuals such as infants, the elderly, and those with weakened immune systems. Vaccinating your child is not just about their health, it's about protecting the most vulnerable members of our society. Scientific research and historical data show vaccines significantly reduce the spread of infectious diseases, protecting not only those who receive them, but also those who cannot be vaccinated due to age or medical conditions. If we have the ability to protect those who are most vulnerable to severe illness, then we have a moral and social responsibility to do so. Another action that's able to be taken is stay informed about vaccine preventable diseases and encourage others to prioritize immunization for their children's long-term health and well-being. Knowledge empowers parents to protect children from preventable diseases through informed vaccination decisions. Vaccines have eradicated or reduced deadly diseases, but misinformation has led to declining immunization rates. Staying informed is essential to safeguarding children's health and preventing unnecessary illness and complications. The last action to be taken is reduce unnecessary healthcare costs by vaccinating your child. Vaccinating your child prevents costly medical expenses and reduces healthcare strain. Unvaccinated children face expensive treatments and hospital stays, burdening families and public health systems. Vaccination is a cost effective, responsible choice that prevents financial hardship and supports a healthier society. Widespread vaccination reduces the demand on hospitals and medical professionals, ensuring resources remain available for other critical healthcare needs. Countries with high vaccination rates experience lower healthcare costs associated with preventable diseases, proving that immunization is not only a life saving decision but also a financially responsible one. Choosing not to vaccinate increases the likelihood of expensive hospital stays, prolonged treatments, and missed work, all of which contribute to financial hardship. As we've discussed the importance of vaccinations today, remember this: vaccinations are critical not only for protecting our own health, but for safeguarding the health of our community. It's our collective responsibility to ensure widespread vaccination in order to prevent the return of dangerous and potentially deadly diseases. Vaccination is a shared responsibility. A single shot saves lives, protects the vulnerable, and secures our future. Thank you.